Good morning. I'm Stephen Guffey and I'm Associate Professor of Physical Therapy at Arkansas State University. I wanted to demonstrate a treatment for you today using deep tissue oscillation. This is a technique that's really quite good for a number of musculoskeletal applications, from acute to chronic situations. Our patient today has a subacute quadriceps strain. It's got a little bit of puffiness and certainly some tenderness in the quadricep. We're going to use the deep tissue oscillation to treat this, and it is very much a manual type of technique, but it includes electrical stim. But this electrical stim is a little different. We're actually not transmitting electrical stim to the patient as much as we're establishing a circuit in me, the clinician, as well as in the patient. The patient's holding a ground mass, and I'm connected to the circuit through this electrode on my arm, but I'm wearing non-conductive gloves. What we're going to do is we're going to bring the two circuits close together. And as we do it, and they're alternating very rapidly, what will happen is when I'm negative, I will attract positive ions in the patient, and when I'm positive, I will push away those positive charges, and what we get is an oscillation in the tissue. Now, I've used a powder as a medium so that I can move smoothly and absorb any moisture, and as I said, I'm wearing these non-conductive gloves. This allows me then to do whatever amount of pressure or direction of pressure that I think is appropriate. Now, since this one is subacute, we're using a mid-range of frequencies. If the patient were acute, we would probably want to use a very high frequency, and if he's more chronic, we would use a more low and thumping type of a delivery of the energy. But the big point is that this allows the clinician to become involved in the situation, allows you to feel for areas of tenderness, adhesion, edema formation, and this technique is very good at helping to remove those, both from the effect of the electrical fields as well as from the actual pressure that you apply in the direction of return circulation. Usually we'll deliver this treatment 10 to 15 minutes based on the patient's response, and it does have quite a blood pressure effect. I have noted personally that whenever I do 2 or 3 of these treatments in succession, that I actually will experience some lowering of my own blood pressure. So it's a pretty dynamic treatment in that regard. It's called deep tissue oscillation. It's a combination of electrical stim and soft tissue mobilization techniques.